Hello, I'm Dr. Martin Posen, the Chief of the Division of Hand Surgery at NYU. The history of our hospital dates back to 1906, when the Hospital for Joint Diseases, commonly known as HJD, was founded by Dr. Henry Frauenthal. In 1998, the Departments of Orthopedic Surgery at HJD and NYU were merged. And in 2017, HJD was renamed NYU Langone Orthopedic Hospital. It is one of the oldest hand fellowships in the United States, and we have more than 125 graduates, and almost all of them are exclusively hand and upper extremity surgeons.
I'm Dr. Louis Catalano. I am the director of the Hand and Upper Extremity Fellowship at NYU Langone Medical Center. One of the common questions I get is what we're looking for in our fellows. We're looking for someone who's honest, hardworking, a great team player, and someone who's just generally fun to be around. One of the best attributes of our fellowship is the wide variety of cases that you will be exposed to. We truly cover from the fingertip to the shoulder. You'll be doing replantations and flap coverage, and you'll be doing total shoulder replacements and reverse total shoulder arthroplasty. The rotations are set up such that there are 5 and each about 10 weeks long. 2 of them are at major city hospitals called Bellevue Hospital and Jamaica, Queens. Those hospitals are indigent population, mainly with trauma, microsurgery, flap coverage, and also there's a great amount of independence for the fellows. At Bellevue, you work with the plastic surgery residents and plastic surgery attendings during some of the micro and flap coverage, which I think is an important part of the fellowship. At Ortho Manhattan, Drs. Lickle Barron and myself, you'll be seeing patients with us in the office. The other half of those rotations, you'll be working with Stephen Yang and Omri Ayalon. There is a fair amount of arthroscopy performed. Last year's case logs revealed 131 shoulder arthroscopy codes, 73 wrist arthroscopy codes, and 6 elbow arthroscopy codes. And the average number of codes for the departing fellows was 935. An important part of our fellowship is that the schedules are not etched in stone. That means if someone's doing a total elbow on a day you're supposed to be in my office, you can just let me know that you're going to cover the total elbow with a co-fellow, and no one will be mad that you're going to miss my office hours. That's an important part of your fellowship where you need to seek out interesting cases or interesting research to do, and that's why we really need to have a good fit with who we choose.
Hi, my name is Steve Glickle. I'm the Director of Research in the Division of Hand Surgery in the Orthopedic Department at NYU. We consider research to be a priority. Understanding research methodologies isn't only important if you're considering a career in academic medicine. Every practicing hand surgeon should be sufficiently facile with research principles to understand and critically analyze research projects, because ultimately it's that research which results in breakthroughs in clinical practice. We require that each fellow work on a project that results in a publishable paper within their fellowship year. Toward that end, we have a full-time research coordinator who works with the fellows to develop IRB proposals, shepherd those proposals through the IRB, and on the other end, work on data collection and manuscript preparation. We periodically have volunteer research assistants who are mostly young, bright postbacks who are interested in research and happy to work with the fellows. We have bi-weekly research meetings in which the fellows meet with me, Dr. Jacques Hockabord, one of the young attendings on the hand surgery service interested in research, and any of the other attendings who are interested and available. The purpose of the meeting is to review the progress of each of the ongoing studies and to try to troubleshoot and identify hurdles or obstacles that we can overcome in order to complete the studies in a timely manner. Most of the research on the hand surgery service is clinical. We usually have several ongoing prospective studies, and one of the opportunities for incoming fellows is to jump on one of those studies begun by a predecessor and complete it during their fellowship year. There are cadavers available for anatomic research, and that is an avenue through which an idea can be rapidly developed into an anatomic study which can be expeditiously completed and published within the fellowship year. There is some opportunity to do biomechanical research and also to collaborate with other services within the hospital like radiology.
I'm Jacques Hochboard. I'm one of the attendings here at NYU. So 3 things I'm going to talk about briefly about our hand fellowship that makes it very unique. First thing is Bellevue. Bellevue Hospital is a city hospital, oldest city hospital in the country. It's the busiest replant center in the state of New York. Another thing that makes it very unique is that you're actually part of the plastic surgery department there when you're at Bellevue Hospital. So you see a lot of the soft tissue management with me as one of the main attendings there. That leads to our next point, the microsurgical experience. Our microsurgical experience here at NYU is continuing to grow. We're very excited about this. It's one of my big passions, and that along with peripheral nerve. So your exposure here is going to be robust with microsurgery, specifically with flaps and replantation surgery and such. And the third is our Center for Amputation Reconstruction with Dr. Ayalon, and I have started this in 2019. Something that we're very excited about for amputees and other people that have lost limbs, upper extremity and lower extremity, to optimize their function. So that's with a lot of targeted muscle reinnervation and regenerative peripheral nerve interface and such. Those 3 things definitely set us apart from other programs here in New York City.
I'm Nader Paksima, Associate Chief of the Hand Service, and welcome to the Manuel Kaplan Fellowship for Hand Surgery. We're really excited to have you here, and I'm going to talk to you about Jamaica Hospital. Jamaica Hospital is Level 1 Trauma Center. It's the busiest orthopedic trauma hospital in all of New York, and we've been there for the last 23 years. What you expect to see at Jamaica Hospital are things like high velocity injuries, vehicular traumas, the knife and gun club stuff, as well as work injuries. You're going to see high energy distal radius fractures, open fractures, forearm, elbow, and we work in close collaboration with our trauma colleagues. So it's not unusual for a hand fellow to scrub in with one of our trauma surgeons if they have an interesting case like a distal humerus fracture or something along those lines. The role the hand fellow plays at Jamaica Hospital is an important one. It's a leadership role. You'll round on the patients, you'll see patients in the clinic, and then operate on those same patients and see your post-ops. So it's a very good continuity of care. And the hand fellows have always been an important part of the team there. Another thing we're really excited about is our expanding micro profile at Jamaica Hospital, where there'll be flaps, free flaps hand rotation, as well as our limb salvage service. There are 4 hand surgeons currently actively working at Jamaica Hospital, so you'll get a good taste of different approaches.
My name's Omri Ayalon. I'm one of the hand surgeon attendings here at NYU. Thank you for your interest in our program. Every Tuesday morning, we have protected time for educational conference. Now, this is time that we have generations of hand surgeons attending, so there's lots of experience that you benefit from in one room or one virtual room, depending on the time. And we review complex and both simple cases, and this might be one of the single most beneficial aspects of your fellowship because you get to talk to hand surgeons who've done it before you. Another thing that I think is important is training the fellows how to be educators. So we expect the fellows to be involved in the education of residents, both in providing journal clubs and actual hand surgery lectures. So we hope that when you're done with your time here, you are an able and capable educator as well.
My name is JD Detola. I completed my hand fellowship at NYU and am fortunate enough to be joining the faculty this fall. I will be based primarily at NYU Langone Brooklyn Hospital and Ambulatory Care Center. The Brooklyn experience complements an already well-rounded hand and upper extremity fellowship. Fellows have the opportunity to care for a really culturally diverse patient population with an interesting blend of acute and chronic hand pathology. In addition, as a Level 1 Trauma Center, NYU Langone Brooklyn will offer additional opportunities for fellows to care for patients with traumatic injuries of the upper extremity.
I'm Ali Azad. I completed the NYU Hand and Upper Extremity Fellowship this past year and have since come on board as faculty. From a fellow perspective, the thing that first caught my eye about our fellowship on interview day was how genuinely interested each and every faculty member was in fellow education and mentorship. They truly want the best for you professionally and personally. Your goals become their goals for you. On that same note, the time you spend with the faculty is a great opportunity to learn what it means to be a great teacher and mentor. Having this blueprint allows you to emulate and develop your own style when teaching and guiding the residents during the year. Another invaluable aspect of this fellowship is the breadth and depth of cases. Sharing the year with 4 of the co-fellows meant that there was always a friend available for you to lean on, ask questions to, or just for some affirmation of your plan. All in all, this was an incredible year that I hope everyone gets the opportunity to experience during their fellowship year.